This is an extract from the Leader Coronavirus Daily podcast by the Evening Standard and hosted by me, David Marsland. To hear the whole thing, search for it on your podcast provider. After the big announcement, the government's now delivering the details on how lockdown will be eased on July 4th. Guidance has been dispatched to the businesses affected. It includes things like telling hotels to leave room service at the door. Pubs are being told to warn customers police can be called if they're not socially distancing. Caution is the watchword from the Prime Minister. This is, as our editorial column explains, a tricky balancing of risks.
Why did the lockdown come in? Not to end all infection, but as an emergency measure to stop the NHS being overwhelmed by a disease that was racing out of control. That worked. Now, death rates in London have dropped back to normal levels, and new infections are falling fast. The economic, social and mental health risks of keeping lockdown going are greater than the health impact of letting go. We can do this because we're in a better place now in our understanding of how to treat the disease and in tracking and tracing people who might have been infected. We can manage this crisis in a way that is better than a blanket lockdown. All that means London should continue reopening. It doesn't mean yet that the nightmare is over.
That nightmare would be a second wave, causing a new lockdown and all the health and economic consequences that would follow. Some of the country's leading doctors are worried the UK's not ready for that. They've written an open letter published in the British Medical Journal calling for a review of our preparedness. It's backed by the Royal Colleges of Physicians, Surgeons, GPs and Nurses, as well as the chairman of the British Medical Association, Dr Channd Nangpaul, who's with me now over Zoom. Dr Nangpaul, let's start with the easing of lockdown itself. Is it too soon?
I think what's really important is to first understand that the virus is still circulating in the community at large. 35,000 people in the UK currently are infected. It's still the same highly infectious, contagious virus as has been the case from the beginning of the pandemic. And we've seen in other countries like in Germany how easy it is to go from a stable situation to have a massive outbreak in the local area, such that they have now had 2 lockdowns in 2 regions in Germany. So we cannot be complacent. And if there is easing of lockdown, and in some cases, of course, it would allow family members and households to meet with others, you have to put in place measures to prevent further spread. And what we haven't heard from the government is exactly what those measures will be.
What should they be?
Yesterday, the BMA stated that if we are to have people mixing more, if we're to lower the distance between people, then one of the mitigations surely should be for face coverings to be worn in indoor public places where people are close to each other. Now, it doesn't make sense to have a policy that applies in an underground train when in fact the same virus can have the same effect if you're in a queue in a supermarket or next to 3 other people trying to get a stock from a supermarket shelf. You know, it doesn't make sense. Equally, if you're traveling in a taxi, you're at risk, and we could go on. So we would like to see the government put in place those clear mitigations and explaining it to the public as to what will be taking place before we go to a further easing down of lockdown.
Is then a second wave inevitable?
The second wave is not inevitable if you put in place the right measures now. And in addition to the mitigations to prevent spread between people, you have to have an agile and one that has capacity test and trace system. And this has also been a problem for us because when we first heard of the initial lockdown, we were told that this was going to be matched by a world-beating app test and trace system. Now that that app has not materialized, we are left actually without a fully comprehensive system. And why it's so important that the government puts in place proper public health measures, really ramps up the capacity of more traditional approaches so that if there is an outbreak, if people become infected, you can identify them rapidly, you can isolate them and their contacts rapidly and prevent the possibility of a second spike. So it requires both a test and trace system plus the measures to prevent spread.
But while coronavirus is still around and there is no vaccine, surely there is then no safe time to come out of lockdown. But that's something that we have to do because our economy is being crushed.
I think that there are grades of lockdown. I mean, we heard, in fact, very clearly from the chief medical officer that this virus is going to be around till 2021. So we're not going to have a normal functioning society. What I worry about are the sort of messages to the public that if they're not fully cognizant of just the level of continuing spread we have of infection, that they may actually let down their guard. And that's a government's responsibility to explain to the public that we are still in a highly susceptible environment and that life will not be normal, but you may have elements of normality contained within a framework of caution and restrictions. And those restrictions will continue until this virus is either suppressed or we have a vaccine. So we need to be putting out those messages. My worry is if the way in which the government has announced the lockdown is perceived by the public as if we're now, we've come past the peak. They look at a graph and think, well, it's all going away. Well, it isn't all gone away. And as I said, not only have we had outbreaks in Germany, the World Health Organization has announced that, in fact, far from going away, globally, the virus is continuing to spread in an unabated manner.
If there is a second wave, and let's hope that there's not, but if there is one, could doctors cope with having to do all of this all over again, having seen the exhaustion and the stress that they've been through? Can they do it twice?
It's a good question because we have been doing tracker surveys throughout the pandemic, and only last week we asked this very question, and about 40% of doctors are extremely worried that they just will not be able to cope. In fact, already they're describing symptoms of stress, burnout, anxiety. We must also remember that the first phase occurred in the UK from about, it started peaking from after March, so in the spring. If we have a second spike in autumn or winter, that could coincide with a flu outbreak, a national flu outbreak, which could overwhelm the system. So we have every reason to be worried, and every reason, therefore, to be absolutely vigilant and to put in place every measure possible to contain this virus now, because the NHS will be under extreme capacity pressures in the winter.
Search for the Leader Coronavirus Daily on any podcast provider to hear more from the podcast.